Hello, welcome to our virtual audience for tuning in to episode 9 of CNAR TV, Engaging Registrants in the Public, Technology as a Barrier and an Enabler. My name is Leah Hubick, and I am the Registrar for the Chartered Professional Accountants of Saskatchewan and the Treasurer of the CNAR Board. Today I'm joined with Delia Sinclair Frigault, the Equity, Diversity and Inclusion Manager and Interim Manager of Strategic Policy at the Ontario College of Pharmacists, OCP, and Kurtis Barrett, the Manager of Public Relations from the Retirement Homes Regulatory Authority. I think it probably goes without saying that technology is pervasive in all things we do as a society. Regulators have moved almost completely to using technology for compliance, communication, and engagement. So we're going to discuss today the opportunities with that and the potential barriers with using technology. So first, one dimension of technology is the generational trend. We have young adults coming into our professions, balanced with some of our older registrants, and their use of technology may not be as sophisticated. Kurtis, can you just share a little bit from the RHRA on your experience with the seniors living in retirement homes? And what have been a couple of the challenges you have in relying on technology, and how have you adapted and relied on a mix of those tools of engagement to ensure you have a broad reach?
Thank you. One of the things I think as a regulator for retirement homes that we have to acknowledge is the digital divide and issues of access, especially in rural settings. Now, we definitely have some digitally savvy seniors. Our most recent Resident Champion Award recipient actually teaches JavaScript to some of his fellow residents, something I personally know nothing about. But broadly speaking, social media and digital platforms are likely not the best way to engage seniors. And so the question then becomes taking a step back and thinking, where can we meet them where they are? Well, we know that when folks have concerns and they don't know who to go to, they often go to their member of provincial parliament, their MPP. And so what we've done is, as part of our strategic plan, we've been meeting with MPPs across Ontario to let them know who we are, what we do, and how we can support them in helping their constituents should they ever have a concern. And that relationship building has been really, really important because it allows us to send information packages to their constituency office so that if someone comes with a concern in person, they can make that referral. We also include information that we can provide to them so that they can put it in their newsletters that go out to their various communities across Ontario and could land in the hands of various seniors or prospective residents. We also get invited by forming these relationships, get invited to the various events that are going on in the community that otherwise would not be on our radar. And we're attending one later this month that we got invited to. And so it's really great to hear about the different things going on. And finally, what's really nice is we actually have some energetic MPPs. And so we had one who took our information packages, visited a retirement home over the holidays and was handing them out. And the information contained in that has details about a resident network or a stakeholder advisory council. And these are different ways that people can get involved and are creating pathways for engagement.
So I'm hearing that balance is really what's important. Delia, do you have anything to add to that?
I guess just quickly, it's really interesting to think of the outside of the box ways that regulators can connect with those like our MPPs and really to connect to the population you're trying to engage. It's really smart. So thank you for sharing.
Well, yeah, and I think we rack our brains trying to think of other approaches for direct engagement. Maybe direct engagement isn't always the only solution. It's that indirect engagement. How are you forming relationships with your communities or like-minded stakeholders who serve the same audience? And that way, through collaboration and that relationship building, you can actually create opportunities and pathways for engagement that didn't exist before.
So Delia, in our earlier conversations, you've mentioned that the OCP operated virtually well before the pandemic. So certain methods of outreach and engagement are still being done in person. So clearly two things happening there. Can you just talk a little bit about how you see technology helping your organization be more accessible and broadening who you reach in your engagement?
Yeah, absolutely. So when I joined over 5 years ago, I was pleasantly surprised that I had the option to work hybridly. And I think, for our staff, that was well established, but our committee meetings, the way that we engaged with registrants was still very much in person. And so we were doing a lot of in-person type planning and engagement, but that really meant that we were having meetings mostly in Toronto, mostly in the area around Toronto, and we weren't really hearing from certain pockets of our registrants. And so recently we've tried to engage in a different way, knowing that now we have a lot more comfort around the use of video technology and like video conferencing. And so we actually have established a registrant reference group, which are specifically registrants that are not engaged with any of our other work. So they're not members of our board or other committees. They don't have a role other than to engage with our policy work and with the way that we are thinking about supporting registrants in meeting our expectations. So this is a group that meets quarterly. We do it digitally, and it allows us to hear from those that have not been able to physically come and participate with us. So we have people from all around the province who are working with all different types of diverse groups, not just in your typical pharmacy settings, but also with family health teams, long-term care homes, other types of settings that we don't typically get to engage our registrants from.
That's awesome. I can say, coming from a province like Saskatchewan, having lots of opportunities for people from all over, north, south, east, west, to be able to engage is really important. That you're not just hearing from those people focused in your urban settings. Kurtis, how is the RHRA using technology to enable accessibility?
Yeah, so we just launched recently our licensee portal as well as our complaint web forms. And so that's been really helpful. As we were developing those complaint web forms, we had focus groups with residents where they walked through the process and helped to identify some of the pain points. So one of those was making our web forms mobile friendly, as an example, because a lot of seniors living in licensed retirement homes may not have the full office setup and desktop. I know my grandparents have exclusively used their phone or their tablet. And so making these forms mobile friendly so someone can fill the form out and submit it on their iPad makes the process a lot more accessible for them. But then there's things like plain language, like how can we cut out all that legal unnecessary jargon, or even from a visual accessibility perspective, making those fonts larger. And so what it's doing is cutting down the barriers or the hurdles to get involved in that regulatory process.
Awesome. So I think really what we're hearing is it's really important to know your audience. So maybe Delia, I'll start with you. Can you just elaborate a little bit about how well you've gotten to know your registrants using these processes and the public and other stakeholders to be able to better engage with them? Like, what have you learned from embracing technology here?
It's a great question. So definitely we have multiple mechanisms to hear from our registrants. And so I don't want to give the impression that this is our only way. But what we noticed was that there were still gaps in who we were hearing from. And so we wanted to be a little bit more deliberate in seeking out voices that we weren't hearing from. And so some changes that we've experienced already with engaging this group include more guidance and advice from that group to our board or to our staff on how to implement maybe a decision in a way that encourages further uptake with those who might be not really paying attention to what the regulator is doing right now, and really communicating that a little bit clearer. So I think for us, it's really connecting back to the engagement, who our audience is, but then also how we're communicating back what we've been doing and what we're learning from it.
So Kurtis, do you feel like you've learned more about your audience?
Yeah, well, we're lucky. We have our stakeholder advisory council, which is something that has helped us understand our audiences a lot more, because it's comprised of our residents, their families, their caregivers, licensees and operators, regulated health professionals, as well as our senior advocates. And so this forum with all these various perspectives and audiences allows us to throw out ideas and get them to have that dialogue and debate. And they don't always agree. And we wouldn't want them to agree. We want part of that dialogue to dissect some of our ideas from these various different perspectives. So having this council has been really, really helpful for understanding those various lenses.
So we've talked a lot about the really good things that are happening. So let's talk a little bit about the risk associated with using technology. So, from your experience, and I'll start with Kurtis because I've given Delia the floor a couple of times. But what do you think is a key risk for you that you're trying to minimize with using technology to broaden your reach to registrants in the public?
Well, I think it's the tunnel vision that technology, while it's an amazing complement to a suite of tools in our tool belt, it's not the only approach that should be used. And so where can you invest in technology? But from our experience at the Retirement Homes Regulatory Authority, it's really about how are we also investing in those community partnerships and exploring all that huge gambit of opportunity there.
All right, Delia, want to respond?
Yeah, I would agree. I would agree with Kurtis. I think OCP's use of technology works really well for certain populations we're trying to engage, but it's not going to work all the time. And I think also we recognize that the move to virtual allowed more engagement in some ways, but there are some things like some committee work or some training or some sort of some in-person learning that is just better in person for other reasons. And so you have to really be able to identify what is it you're trying to get out of that engagement so that you can tailor it to the outcome that you're seeking and make sure that you pick the right method that is going to work.
I agree. I think even from our perspective, like we've done a lot of in-person events and we do a lot with technology, but certainly you need both. And it's interesting even to have the same people who will engage with you in both platforms because they see that there's value and it's just a different level of ways to communicate. So those are our questions for episode 9. So any final comments or thoughts from either of you before we let our CNAR TV audience go back?
Know your audience. What are their perspectives? What are their needs? And how are you meeting them where they are? I think would be my final takeaway.
Yeah, and if you think one method of engagement is going to work and you try it and it doesn't, that doesn't mean that you shouldn't keep trying, right? We can always adapt, change, and grow.
Awesome. Well, thank you so much, everyone, for tuning in. Thank you so much, Kurtis and Delia, for your participation.
Thank you so much.
Thank you.